Hello everyone, welcome to my YouTube channel. So I'm going to be looking at a question that has been asked to someone that went for American Society for Clinical Pathology exam. So like I keep saying, these questions can also be asked in any of the pathology interviews, whether it is for biomedical scientists or as the case may be. So I want you to, put that into consideration. Don't just think that is all about American Society Pathology exam. Okay, all right, cool. So we are going to be looking at DAT. So I think the question is based on maybe how we can be able to interpret possible results of DAT. Okay, but before we continue, my name is Dr. Emmanuel Obodo. I'm a biomedical scientist, and I'm also a lecturer in biomedical science here in the United Kingdom. So let's look at the question that this person, has been asked or was asked. It's a neonate has a positive direct antiglobulin test. A neonate has a positive direct antiglobulin test, which is DAT, okay? What is the most likely diagnosis? Now, a neonate has a positive direct antiglobulin test, or what some people may call direct cum test, okay? Now, what is the most likely diagnosis? Remember, it said diagnosis, okay? So what that should go to your head quickly is what we call hemolytic disease of the newborn. So remember, we can also say hemolytic disease of the fetus. Okay, so now this positive DAT, which I'm going to explain, can happen either fetus, okay, or as a newborn. So that's why we call it hemolytic disease of the fetus or the newborn. Does that make sense? Okay, now I'm going to explain this more. So when we need to, first of all, let's go back and look at DAT. So when we say DAT, what exactly are we talking about? So DAT means direct. So anytime you hear direct, especially when it comes to blood transfusion, okay, or maybe should I say hematology as well, anytime you hear something like direct, what you are looking at is on the cell, okay? Anytime you hear the word indirect, what you are looking at is not on the cell, is actually on the plasma, okay? Now, because DAT is direct antiglobulin test, so what we are looking at is on the blood cells, on the red blood cells. So now for DAT, you are looking at something like IgG antibodies. Don't forget that in your blood grouping, when you say antibody A, antibody B, or antigen A or antigen B, that is not IgG, they are IgM, okay? But when you say something like resource positive, or when you say D antigen positive, so that D antigen or resource, as you may call it, is IgG. So when you say anti-D or antigen D, that is IgG antigen or antibody, as the case may be. But when you say antigen A or antigen B or antibody A or antibody B, that is not IgG, that is IgM. So the reason why I want to explain this different is because it's going to be important in this explanation, okay? Now, just imagine that a woman is pregnant, because he's saying a newborn, okay? And I said it could also be fetus, maybe the baby is still in the womb, okay, as a fetus. Does that make sense? So now, if a woman is pregnant, and maybe this woman has developed, maybe in the past, okay, a kind of antibody, IgG antibody. It could be antibody K, it could be antibody C, it could be antibody, like it could be any of the IgG antibody, Dufi A, Dufi B, as the case may be, okay? It could be any of them, okay? Now, that antibody that woman has developed, okay, once by any chance it passes from the woman to the baby, if the baby is still in the uterus, okay, that is a fetus now, that will cause that antibody to bind on the red blood cells, and that can start destroying the red blood cell, which is hemolysis. Do you understand? Now, that can destroy the baby's red cells while the baby is still in the still in the uterus, and that is hemolytic disease of the fetus now, okay? But that same baby may have survived it, and now the baby is born, and that antibody is still on the surface of the baby's red cells and still causing hemolysis. But remember, at this point, the baby has been delivered. So the baby is born. The baby is a newborn. Then we can call it hemolytic disease of the newborn. Do you understand me? So that is what we call it, hemolytic disease of the fetus or the newborn. So it's dependent on what you are looking at when it comes to that hemolysis. So once the antibody passes from the mom to the baby, if the baby is still on the uterus, that is fetus. Now, if the baby has been born, it's still the antibody, that is not the newborn. Okay? Now, so when we say DAT, what DAT is measuring is that antibody that is on the surface of the red blood cell. Okay? So what it means that if we now have a neonate, a newborn baby, okay, that the DAT is positive. This is a newborn baby. So if the DAT is positive, somehow, something has passed from the mom to the baby. Okay, and that could be what? That is likely to be what? An antibody, IgG antibody. Okay, so that is why I say a neonate has a positive direct antiglobulin test. So what is a likely diagnosis? So if that antibody bind on the surface of that very fetus or the newborn baby, okay, now that binding will cause hemolysis, and that condition is called hemolytic disease of the fetus or the newborn. But on this condition is a neonate, so is a newborn. So that means the diagnosis would then be hemolytic disease of the what? The newborn, which is what we call HDN. Does that make sense? Okay. Now, I think I've answered that question. So a neonate has a positive direct antiglobulin test. What is the most likely diagnosis? The most likely diagnosis is going to be HDN, which is hemolytic disease of the newborn. Okay, but let us go and look at the options, like my custom is to explain it. So it's a hemolytic transfusion reaction, B, hemolytic disease of the newborn, which I've said is the answer, C, autoimmune hemolytic anemia, and D is a G6PD deficiency. Okay, so let's look at why it's not likely to be these other options. So when you say hemolytic transfusion reaction, when you say hemolytic transfusion reaction, so there are three words there. Hemolytic, okay? So hemolytic means that the red cells are being destroyed. That is hemolysis, okay? But it's saying transfusion means that the person has been transfused. The person has been given blood, okay? Or blood product, as the case may be, okay? Now, reaction is based on the response, okay? Now, the reason why I'm breaking this is that if what the baby is going through is coming from the mom, that is a form of transfusion. Do you understand me? Okay. Now, you can liken it to be that, but that is not the case. Okay. Because when you say hemolytic transfusion reaction, is saying that it is more likely. Now, remember what I said. So the baby has received this antibody, has passed from the mom to the baby. That's a form of transfusion. Once your body gets, receive or in contact with a blood product, okay, that is transfusion, okay. But on this occasion, when it comes to blood bank, when you hear hemolytic transfusion reaction, now that could be due to maybe ABO incompatibility. Like, think about it this way: someone need blood and you give the person blood, okay. Now, or maybe someone need blood, or it could also be due to maybe IgG incompatibility, okay? So imagine that someone is blood group A and you give the person blood group B. That can cause hemolytic transfusion reaction. Now, imagine that someone is also blood group A and you give the person blood group A, but the recipient is antigen BK negative, but the donor is antigen BK positive. That differences in the antigen as well, okay, that IgG antigen can also cause hemolysis, okay. So what I'm trying to say that when we say hemolytic transfusion reaction, it may not be wrong to say that yes, the baby was also transfused because what the baby was receiving came from the mom, but that is based on the baby's contact with the mom, not necessarily because the baby requires blood. That's where I'm going, okay? Now, when the transfusion reaction, when there's a response, okay? Because even when you say hemolytic disease of the newborn, that hemolysis that is occurring is also a form of reaction, is a response that is based on what has passed from the mom to the baby. So it's still a reaction, okay? But what I want you to see, the difference between the A and B is that when you say hemolytic transfusion reaction, what it means that this person was transfused, this person need blood, and the person was giving blood. So it's more like that than the type of transfusion of the hemolytic disease of the newborn. I hope that makes sense, okay? So where we can say hemolytic transfusion reaction is that somebody require blood, maybe the person is anemic, or as the case may be, will issue blood to the person. Then if there's a reaction, that can become, if the reaction causes hemolysis, that becomes hemolytic transfusion reaction. Okay, right, cool. So that is for that. Now, I had already explained hemolytic disease of the newborn, so I'm going to go to autoimmune hemolytic anemia. Now, when this thing are using the word hemolytic. So once you hear the word hemolytic, red cells are being destroyed. But now, anemia means that the amount of the red blood cells or hemoglobin is now low. So what then is autoimmune? Now, the way I want you to think about it is this. When you talk about autoimmune hemolytic anemia, this type of anemia is not necessarily because the person has received an incompatible blood, no, or incompatible blood product, no. It doesn't necessarily mean that there is ABO incompatible. What it means that this person's antibody is attacking its own antigen. In other words, this person's antibody is seeing, or rather, this person's body is seeing his own antigen as a foreign, and because of that, develop antibody against he or her own antigen. So once somebody's antigen, once somebody's body or system began to see his or her antigen as foreign, the person will develop antibody against it. So once somebody develops antibody against his or her own antigen, that is autoimmune. So when that occurs and that antibody began to bind the red cells and began to cause hemolysis, that process then is autoimmune hemolytic anemia, because that once that antibody is developed by this person antigen, okay, due to the person's antigen, okay, and the thing now began to cause hemolysis, begin to destroy the red cells, the amount of the red blood cell will be low, and that will lead to autoimmune hemolytic anemia. I hope that makes sense. Now, did this say HCPC deficiency? Now, what you must know is that HCPC play a major role when it comes to how healthy the red blood cell is, will be. Remember that when the blood cell is produced, they are produced from the bone marrow, okay? Now, while they are still at the bone marrow, it can be immature as the case may be, but then once it's mature, it can then be pushed out to the system. So when the HCPC is low, that low amount of the HCPC will then invariably cause the blood cells not to be healthy, okay? But when HCPC is normal, it will contribute to the overall health of the blood cells, like red blood cells. Does that make sense? So now, meaning that if you have abnormal red blood cell, it could be due to HCPC deficiency. And when there's abnormal red blood cells, it means that can lead to, anemia, obviously, because you don't have enough healthy red cells. I hope that makes sense, okay? Now, let's go again. A neonate has a positive direct antiglobulin test. What is the most likely diagnosis? A, hemolytic transfusion reaction. No, I've explained that. B, hemolytic disease of the newborn. Yes, that is the answer, okay? And C, autoimmune hemolytic anemia. No. And D, HCPC deficiency. No. And I think I have explained that. I have explained why hemolytic disease of the newborn is the answer. So the answer is HDN, which is hemolytic disease of the newborn, okay? Now, don't forget that just in case they put the word hemolytic disease of the fetus, what it means that the same thing has happened, but at that time, the baby is still in the uterus, okay? But once the same thing has happened, but the person has been delivered, the baby has been born, that is newborn. So that becomes HDN, okay? And not HDF. I hope that makes sense, okay? Now, Another thing I want to put there is the fact that when you have a positive DAT in a newborn, it is a classical due to, that is, like I've said, is mainly because there is a maternal IgG antibody, okay, antibodies rather, crossing from the placenta to the baby. So once there is positive DAT on a baby, okay, or a fetus, what has happened is that there is a classical IgG antibodies, okay, from the maternal system that has passed through the placenta to the baby, and that is what can lead to this very HDN or HDF. I hope that makes sense. In general, what it means that once a neonate has a positive DAT, what it means is that that is likely to lead to a diagnosis known as hemolytic disease of the newborn. I hope that makes sense. Okay, all right, happy days. Let me know what you think about the video. Please, can I ask you to like, share, and subscribe? Also comment, let me know what you think about the video. And thank you very much for listening. If you do have experience and you think that there's something I missed, please feel free to also add it on the comment section. I'm sure it's going to help people that will come across the video. Anyway, once again, I wish you all the best till I come back your way again. Bye-bye.